Good afternoon, one and all. At the outset, I'm very grateful to Dr. Sri Ganesh, JNJ, AIOCRC, and Namrata Sharma ma'am and Rajesh Sinha sir for this wonderful opportunity to showcase a live surgery at this very prestigious platform. So I will be demonstrating phacoemulcification with the implantation of Synergy, CRV, or the complete continuous range of vision IOL. So my patient is a 68-year-old male patient, and I'm operating on his left eye. The grade of cataract is grade 2. So before I start,
what about the right eye?
I'm operating the left eye. Right eye is also cataract and is grade 1.
Okay.
So before I start with my case, I would like to briefly discuss my settings. So I'll be using moderate settings of 50 aspiration rate, 500 vacuum, and a power of 60. So the power, I have done a little modulation here. For the power, I'll be using the, change please, using the long pulse mode here. So I'm getting 6 pulse per second, and the white star is on. So the duty cycle is 8/4. And the overall energy delivered will be 67%. This is for the chop mode. For the quadrant mode, I'll be using the power of 50 ultrasound, and this will be delivered in the form of variable white star. Variable white star is a unique feature in Signature Pro machine because it gives the surgeon the freedom to choose different duty cycles. So it has 4 different types of duty cycles which the surgeon can select depending upon the stage of the surgery, depending upon the density of the cataract, amount of nuclear material available in front of the tip. So this is a very useful feature that I find very useful, and this is kind of a single setting that the surgeon can use for a soft cataract to a moderate to even a dense cataract. So this will be my setting for the quadrant mode.
Very well explained, Sheetal. Very nicely explained. These things normally, are beyond everybody's comprehension, but very nicely explained.
Thank you, ma'am.
Mr. Jaykumar Shah.
Yeah. Change this. Illumination. Table height slightly.
So you are also on 3D, Sheetal?
No, ma'am. I'm on the microscope.
Microscope, perfect.
Yeah. Slightly. Yeah. So I hope the feed is clear.
Yeah. Perfectly all right. Very well focused, and we can see very nicely.
Yes, ma'am. सर लाइट में देखिए 3 लाइट दिख रहा है आपको? हाँ जी, बस लाइट में देखते रहिए. So I start my case by making my 2.8 millimeter entry incision. I like to keep my incision little peripheral because the limbal wounds heal better and they are more stable. So that's my 2.8 millimeter incision. So we're injecting some Xylocard. Sir, थोड़ा सा जलन होगा अभी, आराम से रहिए. Very good. So I have to put some visco before I start my rexes because if there are any bubbles, these bubbles can be expressed out. Sir, light में देखते रहिए, बहुत important step अभी होने जा रहा है. हाँ जी. So I would aim at a rexes of 5 to 5.5, which is considered to be ideal for a good IOL optic overlap. Excuse me.
So, which viscoelastic you use?
I use 2% HPMC. 2% HPMC for my routine cases. If I have a shallow AC, then I like to use high viscosity OVD like Helon. I think I've been able to achieve a excess of around 5 mm.
Perfect access.
Yes, yes.
Perfect access, Sheetal. Very nice.
Yeah, wonderful.
So that's the hydro. You can see the nucleus rising.
Yes. You can see the wave as well. Very nice.
The posterior wave with the nucleus rising, and
Yeah.
that makes the rotation of the nucleus also easy. So as I said, for the chop mode, I'm using a 6 pulse per second long pulse. So I'm using a chopper of 1.5 millimeters length. I like to aspirate the superficial cortex to get a better view.
So you'd like to do a direct chop, Sheetal?
Yes, ma'am.
Okay.
Sometimes you don't reach the depth, so might have to rotate and then bury again. Yeah.
Perfect. I think that was
So needs to be held properly, and the depth has to be adequate.
so excellent. I think very nicely. It's 2 chops already, 3 pieces already, and I think you'll break it into 4.
Yes, I'm intending to make it into 4 pieces. Yeah, I got my 4 pieces now, so I'm shifting to the quadrant mode. So in the quadrant mode, as I said, I've got the variable white star on. So I'm right now using the duty cycle of 2 and 3 here, a combination of both in the variable white star. And you can see this is a ellipse FX handpiece, which is a great combination of longitudinal as well as transverse phaco, which helps in improving the efficiency of the ultrasound, as well as it improves the followability. Also, the chances of the nuclear material getting clogged in the tip are also minimized because of the transverse phaco. So it's my last piece now. We just want to take it very slowly without reducing the parameters.
You can see the followability is wonderful.
Yeah, followability is excellent, and also the chamber stability. If you see,
Yeah, chamber stability.
there's no surge.
Yeah,
There's absolutely no surge. My settings are written on the higher sides, 50 and 500 though.
Yeah.
But you can see the chamber is rock solid.
Rock solid with wonderful followability.
Light में देखिए sir.
That was really excellent.
Yeah.
जी मैम लाइट में देखिए सर.
As if the pieces were obeying your commands,
Yeah.
Really, they were just it was done very well.
That's the machine. Great machine.
And also the person behind machine.
Person behind me.
Operating the machine.
So I have I'm using the coaxial mode. Saline please on the cornea. Sometimes you can have these small fragments floating in the chamber. So I just kind of pull them out. Sometimes if they don't come, then it's better to flush them with saline. Please give me a little saline. I also see that the cortex is a bit sticky. Sir, light में देखिए please. Yeah, light में हाँ जी. So I just flush it so they don't interfere. And I also want to slightly loosen this cortex.
It's a wonderful method to loosen the cortex. Sometimes
Yeah, because it's very
cortical
sticky.
fibers attached. So with the fluid, you can detach that. So it's a very safe, wonderful method. Very nicely being demonstrated.
Give me the, oh please. Just aspirate this.
Excellent. I think of notable, there's a notable feature today. We have a very high audience or high number of people who are watching today on the Facebook and on the YouTube both. So I think it is a great thing. People who cannot visit or have not visited Netradhama can see their OR of Netradhama on their laptops by excellent surgeons like Sri Ganesh we saw and now Sheetal.
So most of the cortical matter is
Out.
out. Just have a very thin film here, very thin material. I'll just flush it out with hydro cannula itself. So for hydro cannula, hydro polishing, it's important that you don't put visco before polishing it,
Yeah.
because then the capsule goes back and you need the capsule to be a bit convex at that time.
Yeah.
Yeah, I have the, give me a little IA please. It's better to clean these things before the implantation of the IOL, because after that it's a bit, give me please again.
Yes.
Yeah, this bit is a bit sticky and there were bubbles earlier, so I've cleared the bubbles. Yeah. IA. I think it's fairly clean now. I'll go ahead with the implantation of the IOL.
Yeah, just coming in a minute.
What lens are you
So
implanting?
I'm also implanting the Technis Synergy continuous range of vision lens for this patient, because patient desires a spectacle-free vision after the surgery. So as sir has already explained, that's a combination of multifocal with a EDOF lens. The EDOF technology is actually superimposed on the multifocal platform, and this delivers a continuous high quality, high contrast vision from the range of 33 centimeters onwards. So patient can select their preferable distance, because the range of vision is continuous from near to intermediate to distance. So that's not an issue. So sometimes with the traditional multifocal and trifocal lenses, patients have a certain distance, which is their preferred distance for reading and for intermediate. So because the trifocal and bifocal multifocal technologies, they can have gaps. So patients can sometimes have a jump or a gap between the two foci, between the near and the intermediate and the far. So the vision is not continuous between those gaps. So with the incorporation of the EDOF technology, these gaps are eliminated and patient gets a continuous vision. So that's the advantage. Also, this lens has a violet filter. So this violet filter, it filters all the violet light which is responsible for the scatter. So patient's night vision is also expected to be better with this lens.
Very nice. Has a +4 ad?
Yeah, I'm not very sure about the ad though. It's said that it works for all ranges.
Near and intermediate.
Near and intermediate, yeah. Give me the IA, please, little bit. So also you can see that the rings are, the lens, the optic is fully diffractive.
Yeah.
So the optic is fully diffractive means that the rings are there on the whole of the optic, not just in one zone, which makes this lens pupil independent. So patients can have good vision in all light conditions. So the lens looks well centered. The Purkinje images are also centered in the
It's perfect.